there are many interests in rare disease space, and I think one is because there has not been a lot of development in that because of the the cost and the interest, if you will, for rare disease, unfortunately. But the landscape seems to be changing these days, and a lot of awareness, and especially the patient advocacy group is playing a huge role in leading, if not only participating, but actually is leading, is pioneering the research on that front. And we are also really amazed and inspired by their tireless effort. They are affected by this disorder, this devastating disorder firsthand, but they still have a lot of energy, and their goal obviously is to change their life, to make a difference in their loved ones, their kids, their relatives, and so on. For us, it's also really try to help out to make a difference. And I think it's very meaningful because what we are doing really is using our knowledge and make a difference in real life. It's not only writing a nice paper and then putting on the shelf or that kind of thing. But I think that the life impact, the real life impact aspect is becoming more meaningful. And so I think that going back to your original question, what is the hurdle? What is the limiting factor? I think it's really how to prioritize these different resources and making a more streamlined and the most important key steps that we need to tackle. And if there are something that can be shareable, so that's also the idea of what we are working in the lab, is targeting not only SSADH. We think SSADH is a good start, but actually the knowledge gained in this project can be maybe applicable and transferable to other very closely related disorder. This is a class of disorder what we name as GABA-related disorders. The GABA life cycle, if you will, of the synthesis, of the degradation, or the transport or uptake, these different steps of GABAergic signaling has been known that also give rise to different related rare disorders. So, for example, the SLC6A1 related disorders. So it's because of the GABA transporter, GAT1, is mutated. It's a slightly different scenario because it's autosomal dominant instead of autosomal recessive. But in very in a clinical presentation level, patients share very similar clinical manifestation between SSADH and SLC6A1. They both have seizures. They have GABA accumulation in different ways in their brain, but they have seizures, and they have intellectual disability, they have developmental delay, and so on. So we think that some of the knowledge that we gain from SSADH, developing gene therapy, might be usable for SLC6A1, or even something that we can share, maybe a platform we can do together at the same time. So that's only not reducing the cost, reducing some of these resources, but also maybe accelerating that development. Yeah. So eventually, it's really to help other disorders that can quickly go into a more advanced developmental stage.